why you're saying that she is a case of ischemic heart disease? What's the background about ischemic heart
Sir,
disease?
she is giving no background, no admission previously, but she's
very important.
Complaining of exertional angina, like vague symptoms, but on echoes.
Now, these two are contradictory things. You said she's complaining of exertional angina with non-specific symptom. When you label someone exertional angina, this is very specific. What is angina?
So retrosternal chest pain radiating to jaw or back with and relief by
Classical
rest.
definition of angina. I told in last lecture. Who was there in last lecture? Anyone? Angina definition.
It's a chest pain which is increased on exertion and relieved by the sublingual NG
And
or rest.
It's almost correct, but classical definition is retrosternal chest discomfort brought on by exertion or emotional stress and promptly relieved with rest or sublingual nitrates. If you have these three characteristics in any symptom, this is classical typical angina. So you said she is having exertional angina. So when you label someone angina, when you found these three things, and then you said with non-specific symptom, angina तो बोलना ही उस वक्त है जब specific classical symptom हो. That's why it's very important. आप एक जाके ना एक article है, it's by ACC-AHA, definitions in relation to non-ST-ACS. I think 2003 में आया था, उसके बाद फिर वो दोबारा है. उसमें हर चीज़ की क्लासिकल डेफिनेशन है. लेकिन वैसे भी मेडिकल में जब आप कोई भी जुमला बोल रहे हो, you should be knowing exactly what it means. And when you say non-specific symptoms, that means you're not sure about symptoms, whether they're ischemic or not. So what's with her?
Sir, we are
not having angina. So just say.
Non-specific.
ये बहुत बड़ा हमारे साथ प्रॉब्लम होता है कि डिस्चार्ज में हम लोगों को अनस्टेबल एंजाइना लिख देते हैं, एंजाइना लिख देते हैं. Angina is not non-specific. If you are dealing with some non-specific symptom, just write chest pain, query, angina. I don't know. I'm not clear about it. Because this notion will convey to the assessor that this patient wasn't a clear-cut ischemic heart disease patient. And then he or she will be take him or her as that case. इसका मतलब है इनका ISD का background strong नहीं है. That means you can easily hold beta blocker or decrease the dose of beta blocker in this patient. So I think, what's a syncope? Can you define syncope?
Sir, syncope is transient loss of consciousness which is regained with
spontaneously without any बगैर कुछ किए वापस होश में भी आ जाए. That is classical. ठीक. Okay.